but more importantly, our speakers for today. We have Mariana Link and Karina Ward from CSU Northridge, and they will be talking to you all about preparing to implement a smoke and tobacco-free policy. With that, I'll go ahead and just let you two take the lead.
Hi, good morning. My name is Karina Ward. I am the Executive Assistant at the University Corporation at Cal State Northridge.
And I'm Marianne Link. I am Assistant Director at the Klotz Student Health Center at Cal State Northridge. We're going to go ahead and get started and tell you a little bit about our Clear the Air initiative. So in 2013, our president created an initiative where she asked the campus for input on a variety of topics. In this case, whether or not CSUN should become a smoke and tobacco-free campus. And as you can see here, the answer was yes by that survey. We also use the National College Health Assessment from the American College Health Association. We add questions to that periodically. We typically use it every couple of years. We add questions periodically. And in 2011 and 2013, we asked the same question: should CSUN become smoke-free? And again, you can see that the answers were quite positive in that regard. So she appointed members to a task force to gather information and make recommendation. And the recommendation was to become a smoke and tobacco-free campus. In August 2014, our president announced CSUN would become smoke and tobacco-free by fall 2015. Sounds like a long time, but it moved very, very quickly. She formed a new committee, an implementation committee now, and one very important position on that committee was the project coordinator position, highly recommended. The position was held by Karina, who did just an amazing job, and she'll tell you a little bit more now about that position.
Hi, so as Marianne mentioned, I was the project coordinator for the Smoke and Tobacco Free Committee. My main responsibility was to monitor the action plan. This was a giant spreadsheet that was used to monitor all the moving pieces of the implementation. We'll actually see an example of that in an upcoming slide. In addition to monitoring the action plan, I also created the meeting minutes and agenda. I followed up on action items, which is you'll see that there were various action items that each subcommittee had to do to make sure that we were hitting our milestones and that we would implement the policy on time. And then I also monitored the budget. We were fortunate enough to have a budget. So there was some money to spend on materials and marketing. And so I also helped monitor and coordinate the ordering of supplies for tabling events as well as signage on campus. So the policy was effective August 19, 2015, which was the start of the fall semester. As you can see by the boundary map, this included all areas of campus, including the parking structure, parking lots, off-campus lease spaces, on-campus residence, which students, faculty, and staff lived in, as well as state and university-owned vehicles. One of the main focuses of the committee there was a lot to do before the policy went into effect. The committee and subcommittee used the action plan to stay on track and to make sure we were hitting milestones. One of the main focuses was to ensure there was support for smokers on campus.
And I'm sorry, this is just the nature of Zoom these days. I have to take this bone away from my dog because it's getting quite loud. So give me just a moment. Sorry about that. He's a big dog. All right. So beyond CSUN's Employee Action Program, or pardon me, Assistance Program, which many of you are likely to have on your campuses as well, it's important to anticipate the effects that a new tobacco-free policy is going to have on individuals. And so we made sure to have those services and products in place before the policy rollout for anyone who might consider choosing to stop smoking at that point. And these are still in place. So for students, we have smoking cessation services, individual appointments if they'd like. For faculty and staff, again, our HR benefits include smoking cessation services. And then we also were fortunate enough to be able to offer free nicotine replacement therapy products for the entire campus, students, faculty, and staff through the Klotz Student Health Center Pharmacy. Not that expensive, relatively speaking, to this entire initiative, less than $500 annually. In 2019, we were still providing it, and still are now, of course, but 2020 is a unique year. In 2019, we provided $257 in NRT products.
So as you can see, this was a true collaboration of multiple campus partners. The committee had representation for various departments on campus, associated students, police services, environmental health and safety, faculty, HR, the health center, marketing and communications, physical plant management, student affairs, student outreach and recruitment, as well as the university organization. This was a great collaboration because it brought different perspectives of what was needed to be accomplished. Each unit provided their own background and information of what was important to their area. And so the action plan was used. Each department was able to look at the action plan and how it can be effectively completed. We also utilized different avenues of campus awareness. We utilized the campus newspaper, social media, tabling events, and then the committee provided a wonderful space for communication. Each department was able to talk about what was important to them, what was needed to be done, and then we brainstormed on how to effectively implement this policy rollout. So this was a wonderful collaboration. It was a true partnership of all the different areas on campus. So the main committee provided project oversight. We met bi-weekly and then weekly as the policy implementation got closer. And then we met monthly once the policy was implemented. And the subcommittees, they were formed to manage targeted tasks of the different areas of the action plan. Again, we also met bi-weekly, weekly, and as needed. And each area focused on their specific task. One subcommittee overlapped. We did education, training, and enforcement. We met together so that we can talk about what was needed. I attended all the subcommittees as well as the larger committee. I was able to be an area of communication where if we were talking in the communication subcommittee and something was happening in education or training and enforcement, I was able to bridge those committees and say, hey, we're working on that also on this subcommittee. How can we partner together so that we're not doubling up efforts? I updated the action plan, and then I reported back on the main committee. An example of how all these committees intersected was signage. So signage was first created by the Marketing and Communications Subcommittee, but education also provided input on the language for the signage, for the promotional materials to make sure that there were certain things on there that they wanted to make sure that campus knew about. Facilities provided input on the location of the signage. We also offered training to all our campus partners through student affairs, how to engage with a policy violator, how to approach a smoker on campus, and then provided scripts on how to talk to someone that they wanted to approach. Enforcement was really great on providing language on the enforceable education code for policy violators. So there was enforcement signage that had to have specific language so that enforcement can be made. So this is an example of this giant spreadsheet that was used to monitor all the different activities of each subcommittee. So we use this spreadsheet to take a look at what needed to be done. It lists the activities, who was responsible for each activity, the start and end dates, the status, as well as notes relating to that particular activity. This spreadsheet was great at keeping each subcommittee on track. It held people responsible. It kept everyone on the committee informed of what was going on. It also showed the critical path of activities and how each one impacted other subcommittees. We started off each meeting taking a look at this spreadsheet, and it helped guide the meetings to see what we needed to talk about, what needed to be worked on, what possibly needed to be delegated. And it was just a wonderful way of keeping everyone informed of what was happening. We also took a look at the budget at each committee meeting to see what monies were available and then what needed to be purchased. So this is an example of our policy awareness. The first step for the committee was to create awareness that CSUN was becoming a smoke and tobacco-free campus. We were very fortunate to have a creative design team at University Advancement. They came up with the artwork for the Clear the Air campaign. They also created a robust website. The website included scripts, FAQ, a boundary map, where to get cessation resources, who to call with questions, who to call to report policy violators, as well as an awareness video of the campaign. You can see there were lawn signs, a light pole banner, the huge banner that was at the parking structures. We also had coffee sleeves that were put on the coffee cups at the beginning of the fall semester. And then we had these bookmarks that was created. It had little snippets of information of where to get help if you wanted to stop smoking, who to call. And this bookmark was handed out at the tabling events, new student orientation, and they were placed at all of the dining units. And then we also purchased promotional materials, so pens, hand sanitizers, and mints. And again, this was handed out at various events on campus. So we would have people stop at our table, and then we would hand them a bookmark and a promotional item.
So another thing that we did was to use students, and I strongly recommend that you get students involved in your implementation. We started a program consistent with the culture of our campus, which is a caring campus and an emphasis on education and development rather than enforcement. We wanted to roll out an educational program. So we created a peer education program based on Cal State Fullerton's ambassador program. And we hired 4 truly outstanding students to work as these policy ambassadors. We called them Clear the Air advocates. We asked the advocates to visit campus locations we had identified as smoking hotspots, areas where we could still find smokers. And the advocates worked in pairs. And when they engaged a smoker, they did 4 things. They introduced themselves as being with Clear the Air. They explained the new policy. They thanked the smoker for listening and provided a bookmark or other promotional item. And then they asked the smoker to put the cigarette out. And most smokers actually complied. It all took less than a minute. And the smokers were remarkably receptive to this approach. Occasionally, someone would express their dislike of the new policy, but nothing more. There were no altercations, and we really wanted to be sure the advocates were safe and weren't put in any kind of a dangerous situation. They were trained to listen and acknowledge concern, but not to engage in a debate or in any way escalate the situation. They were able to provide resources where further discussion could occur. They also participated in major outreach events such as orientation and special projects such as monitoring signage so that damaged or missing signs could be replaced. The program worked extremely well. Peer education is well received on our campus, and it's been a unique and worthwhile opportunity for the advocates as well. So again, strongly recommend including students in your efforts. We developed a log to collect information on smoking that was still occurring on campus. Anyone on campus could contact our environmental health and safety department to report smoking. We reviewed the log at each committee meeting, and the advocates visited different locations based on the log entries. We also used the log to keep track of missing or damaged signage, and it was again a very effective tool. The log is no longer used today, but people still know to call environmental health and safety, to report any incidents, and also to request their support, and staff, if requested, will go out and speak to smokers. This is 2015-16 data from the log. Green shows the number of locations the advocates or staff visited, and blue shows the number of smokers observed. We used the log to track our compliance rate, which was more than 95%. In addition to reducing smoking on campus, we wanted to demonstrate how the policy would improve the campus environment. So we sent an email to student clubs and organizations, faculty and staff to help us recruit volunteers for a cigarette waste cleanup day. And we really had a great response. We picked up waste from the entire campus, including housing and parking lots. And our budget, we had a large number of volunteers, and for the supplies that are listed here was less than $2,000. So I wanted to just take a quick minute here to thank Cyan on behalf of CSUN. Their help was invaluable. We've had many conference calls, both with our main committee, as well as subcommittees and ad hoc meetings. We've used their materials, and most importantly, they helped us develop a strategy that would be effective for our campus. The only things they've asked us to do in return were to share our story and to complete some evaluation documents so they too can collect some data and show the impact of their work. So if you implement your policy on campus and you are asked to complete some evaluation, we hope that you will support Cyan as well. So moving forward, our committee stopped meeting formally in 2017, although committee members are still available and called upon occasionally. And our advocate program also stopped about the same time. But enforcement continues, and we continue to assess with our National College Health Assessment. So enforcement continues on our campus, and this shows some data we have regarding enforcement, and tobacco arrests are citations, by the way. So again, although we focused on education and we've had excellent compliance, there are still some smokers who still did not comply with the new policy. In those instances, campus police can be called to provide a warning. After a warning, the smoker is potentially liable to receive a citation. So we track both calls for assistance and also tobacco arrests, or as I say, citations. In 2019, we started receiving some complaints that smokers were becoming belligerent to their colleagues who might be reminding them of the campus policy. So enforcement and monitoring was increased for 2019, and you can see the results here. So we administer, as I mentioned, the National College Health Assessment approximately every 2 years. This shows our cigarette and e-cigarette data. E-cigarettes were only, the questions around e-cigarette usage were only added to the survey in 2015. You can see a steady decline in cigarette use among our students with an increase in e-cigarette use, which is concerning and probably consistent for all of us on the call today.
So that was the end of our presentation. It provided an overview of how CSUN implemented the smoke and tobacco-free policy on our campus. And now we'd actually like to open it up to questions that anyone may have for Marianne or myself.
Thank you both for all that wonderful information and for sharing with everybody. We really do appreciate it. You all have worked, so like you all had a fantastic structure when you were doing your implementation, and we definitely at CYN are glad to show y'all off a little bit. We did have one question already pop up in the chat, which was, how successful has the Clear the Air program been? Meaning, has it stopped smoking on campus?
Yeah, and we that last graph that showed the decline in cigarette use would be what I would refer to show the reduced level of smoking. But again, we can also check in with some of the campus departments that are involved, our campus police, our environmental health and safety. But we rely for student data on the National College Health Assessment primarily. I might add also that there's been a decline in the use of the nicotine replacement therapy products, which can be interpreted in a number of ways. So, but it's just another aspect that can be followed, as well as the results of employees seeking assistance through the Employee Assistance Program, our HR program.
Yeah, awesome. And while folks are thinking, by the way, yeah, we are going to be having Q&A for the rest of the time frame. We encourage you all to either type in the chat, or if you want to unmute yourself and ask, feel free to do that as well. It looks like we did actually get a follow-up question of how involved were campus police? Did they issue citations?
Karina, are you interested in adding anything further to that?
Campus police was actually very involved. They were very helpful in the spreading the awareness of the policy. From what I believe there was one citation, as Marianne mentioned, in 2019. Smokers were not quite following the rules and getting a little belligerent, as she said, to people approaching them. So I believe there was a citation issued to show the seriousness of the policy. There were several years of policy awareness, and now in 2019 was when a citation was issued to show that it's a policy that everyone should know about, and now the police issued a citation.
Our smoking hotspots were really quite visible, surprisingly, where cigarette smokers actually gathered. And so it was, those were pretty easy to monitor. And actually, we assumed that word got around pretty quickly, because once the visits started to increase by campus police, we started to notice that those areas were less frequented by smokers. But I will say this too, and that is, as Karina mentioned early on, campus police were an integral part of our main committee and also the subcommittee work. So they were quite involved.
Thank you.
I'm curious to hear a little bit more about the tobacco cleanup day. It sounds like you guys got really stellar attendance, and I just want to hear what you did to kind of get all that participation from students.
I missed the first part of that. Could you repeat the first part of that again? I'm sorry.
Yeah, I was hoping that you could share a little bit more about the tobacco cleanup day and just how you got so many students to participate in it.
So the compliance with the policy, you mean? Tobacco-free update?
The cleanup day.
Oh, pardon me.
Yeah.
Thank you. The cleanup day. I told you I couldn't hear that very well. The cleanup day. Yeah, well, you know, it's interesting. We have a campus where we have quite a strong volunteer program on our campus anyway. And so a lot of students provide community service both on and off campus. So I think, again, it's kind of the nature of our campus a little bit for students to be involved. But we also, both Karina and I work with a variety of staff and faculty across campus. So we have a nice network of people available. And we started out early saying, we're going to have this opportunity come up. We'd like your support to advertise this program and to get students involved. And, you know, I think who really joined us were the students who most were in favor of this new policy. So, so they were very passionate about this and wanted to give us some time. I think also that we only asked an hour of them. You know, it's literally people picking up trash and bending over. It's physical work and all. So we only asked about an hour of them. Some of them volunteered for a little bit longer. But it was an opportunity to get together and help their environment, help their school. So I think it was just a kind of a natural reaction to requests like this that come occasionally on our campus.
Awesome, thanks.
Sure.
And I see another question that popped up in the chat. What was the financial cost of your program, and did that include the NRTs?
We were very fortunate to have a very supportive campus president that provided a budget for this rollout of the implementation. We had a budget for 3 fiscal years. let's see, the first fiscal year, we had approximately $80,000 to spend on this program, and then $60,000 the 2 additional fiscal years. So we were very fortunate to have that money to help with purchasing signage, advertising in the campus newspaper, purchasing promotional materials. I think that really helped spread the awareness of the campaign. So we were at every possible on-campus event, like Move-In Day. At the beginning of each semester, we have something called the President's Picnic. So that's where it's a free lunch provided on the campus lawn. And so we set up a table, we handed out hand sanitizer. So I think that really helped us spread awareness of the campaign. But if you don't have a large budget, there's lots of resources on campus. I would want to partner with you at tabling events or just spreading word. We had a bunch of different departments that came to us and said, hey, we heard about your bookmark. Can we put it in our department? Can we put it in our office? If you have that opportunity, definitely engage with your different campus partners to see how you can possibly put a flyer up just to show that the campus is becoming smoke and tobacco free.
Awesome. Yeah. And if anyone is looking for any of that extra support, we also with CYN, we offer a lot of assistance in the creation of customized signage and such. We aren't able to do the printing for it, but if you are looking for someone and you don't have access to graphic designers or anything, that is something that CYN has the capacity to help with. We also have a whole bunch of other like resources and such that you can use that are like they mentioned in the presentation, that are all free to you for all of y'all. So definitely, if you are looking for some extra support and your budget is low, we can help work with you on that as well. So don't feel like you're on your own if you don't have a large budget. You've definitely got some resources. We also have another question that came up in chat. Have you discussed post-COVID if there'll be new challenges with having people back on campus after so long with very few people on campus? Will there be a budget to roll out refreshed signage and etc.?
Well, I can speak to the first part of that question and say I think that all of us post-COVID, as we return and repopulate our campus, are going to have reminders about a lot of things on our campus and help students readjust, faculty and staff as well. So we're prepared for that. We remain vigilant with regard to this policy. All of our departments are still available to reconvene if we need to reconvene the committee. And again, monitoring will continue, and we have all the processes in place we need, again, to effectively address any kind of a bump up in smoking or e-cigarette use.
And in regards to signage, as I mentioned, we were fortunate to have a budget to purchase items. So the remainder of the budget, once we were established on campus as being smoke and tobacco free, we spent a portion of the budget purchasing inventory to replace signage on campus. So our physical plant management has a stock of banners and A-frame signage. So there is a supply that is at physical plant management. So once campus does come back in person, they'll be able to refresh the signage on campus.
Awesome, thank you. And then I have another question to continue this going on. And again, folks, continue to add in questions as you think of them. So you were mentioning the fact that you've kind of pulled back on some of the, compared to your initial implementation of the, like the student ambassadors and such, like the paid positions and everything. But I was curious about what you all have been doing on your ongoing education on the campus, and like how have you been continuing those efforts after those initial like 3 years to refresh it in everyone's mind each year?
Yeah, well, our smoke-free policy is included in many of the same areas that our alcohol and other substance use policy is communicated. So that's now become a standard item in terms of communicating the policy. But also just our education efforts include now, even more than before, efforts about to provide resources available to students, faculty, and staff about smoking cessation and also e-cigarette use. So we've done many presentations and are available. The Klotz Student Health Center Health Promotion Department does a lot of that work. We meet with student groups, we meet with classrooms and all, and are happy to show the success of the program. We also have requests now and again from faculty who like to use the data that we've gathered for research projects, either of their own or with students who are doing some research and all. So we make that available to them as well. We want to share that data and have it used across campus. So we maintain an emphasis on this, as we always have. And we're looking forward. We're going to actually be implementing the NCHA again this spring, the National College Health Assessment. We look forward to seeing that data and seeing where we are relative to this. It's going to have a big asterisk by it because with 2020, but still, we look forward to the information it gives us. It's just another piece of the puzzle that we use, and we'll incorporate that information as well in our presentations and education efforts.
Awesome. Thank you so much. Yeah, I know that you all have been doing a lot of work with the ongoing education, and I know that that's something that across the board for all of colleges, it's one of the biggest struggles because our population does continually rotate every few years as students graduate and new students come on campus. So thank you for sharing how you all work on that.
Yeah, I'd also mention that we have a peer education program, again, in the Klotz Student Health Center, Matadors for Wellness. And one of their major focuses is the alcohol and tobacco drug use and prevention. And so they have incorporated this information into their presentations, and they are very active. They do many outreaches now via Zoom, but they're very active across campus, and they're well known. And again, that's just another opportunity for us to get the word out and to really provide resources as much as anything about the cessation services that we have on campus to help students who might be in need, might be interested.
I have a question real quick too, especially like I guess with along the idea of like the data collection. Is there any bit within that data collection that kind of follows like the demographics of people like receiving citations or the arrests due to the policy implementation?
Yeah, I wish we had our enforcement group on this call to answer that question specifically. What I can tell you is with regard to the assessment data that we're involved with, for example, the National College Health Assessment now, we certainly can break that out by demographics or a number of other ways as well. And we do that. But I don't have an answer. Karina, do you have anything about that for the enforcement piece? It's a great question and probably something we should look at. So I thank you.
No, I'm sorry. I don't know that they collected that aspect of the encounter. From what I recall, the spreadsheet just showed that there was an interaction, but I don't know that it specified specifics about the person they interacted with.
Thank you. I was just curious.
Awesome, thank you. And we have a couple more questions that came in the chat. So the first one is, how do you inform incoming students on the policy?
Well, a couple different ways. we have a required orientation program. And so most all of new students attend our orientation where they go over the different campus policies. So it's there. It's included in a number of different publications that students receive. And then individual departments also will provide that information. So for example, housing will have their own policy, and they'll go over that as well for new residents. So probably many of the standard ways that other campuses communicate that any new information or any campus policies at the beginning of an academic year.
There is also information at CSUN. We use something called Canvas. So you log into your student portal. There's also information in the student portal about CSUN being smoke and tobacco free.
Awesome, thank you. And the next question I have is, what is the best advice you can give to an institution that is considering something like this? Specifically, how do you get an initiative like this started? Some ideas for first steps.
I'd start off with doing an assessment. I'd start off and seeing what the campus climate is around becoming smoke and tobacco free. Ours was quite supportive of that initiative, but it might not be the case on every campus. So I would definitely start off with assessment data so that you can then share that data and use that to either perhaps create awareness and education programs and all in anticipation of going smoke and tobacco free, or as we did, to share it with the administration and the president to show the support behind it. So right off the bat, I would share that. And then the second thing I would say is we moved actually quite quickly on this implementation, but we still tried to have as much lead time before policy implementation. That allowed us to have the structure that Karina went over because it was really, really necessary. Whether you're a large campus as we are, or close to 40,000 students, or whether you're a smaller campus, the same people and departments need to be involved. The same issues need to be addressed, concerns need to be addressed, and things need to be in place before the policy begins. So having that structure in place, although Karina had to keep us all on track with all of our tasks and creating ad hoc meetings and bringing subcommittees together, ensuring that we met our incremental deadlines as well as the final deadline, which again was just a really important position. But that structure allows all of that to happen and to move forward in a really concerted effort.
Amazing. Yeah, and kind of tied into some of that is you mentioned earlier that you had the some of the paid students that were helping you out. Where did you initially advertise to get some students that were interested? Like what groups did you reach out to first to really get that student base built?
Yeah, we really probably just did as much as anything word of mouth. You know, we reached out to faculty connections that we have, people we work with regularly, and we bring interns into the CLOT Student Health Center as well. So we reached out to the faculty with whom we usually work with. When we request applications for peer educators, we send out a very we broadcast that opportunity widely across campus to many different departments. So we would send out an email, something like that, again, advertising this new program. And then students applied. We would go through the same process. We asked them to apply and went through a selection process. And one of the health educators in the CLOTS health promotion area, she was their advisor. And so again, I think it's just those connections you have across campus. You oftentimes don't have to create everything brand new. It's a new initiative, but all of your connections are in place. The departments are doing similar work already. So you can use that to build on.
Awesome. And anyone who wants to add in more questions, feel free to. I have lots of questions that just keep popping in my mind, so I'll keep asking them, and always feel free to interrupt me. Um, so for some of our folks that are in this particular call that are off-campus partners and who are folks that want to be able to help the campus in making these initiatives, did you have anyone part of your initiative, part of your task force that was kind of part of the like an off-campus entity, like the community health or anything like that? And if you didn't, what would you recommend as like for some of those folks that are coming in from the outside? Like how could they help without stepping on toes or making anyone feel displaced or anything?
So we, Karina, correct me if I'm wrong, I don't think that we had any regular people coming into our main meeting areas, but we certainly looked to what other schools did for some of the support that they received. Again, everybody is so different. We fortunately have so many resources right on campus. And then again, great resources, great connections, as we're using, for example, right now with COVID-related activities, we have a strong connection with our LA County Department of Public Health as well. So some of the other schools that we spoke with as part of our implementation and even investigation process, some of the other schools looked to some of their counties for smoking cessation services, for example. And so where we would advertise on campus for that, they would advertise off campus for that. So they had to ramp up for that. When we trained our smoking cessation counselor, we used the University of Massachusetts Medical School training curriculum and sent her for, I think it was a 5-day training there. So we've used some off-campus entities. As we do with some of our other endeavors, our alcohol and other drugs, alcohol, tobacco, and other drugs advisory committee, which by the way used to be alcohol and other drugs advisory committee. We've added the tobacco in now for years now. And we have some representative from alcoholic beverage control and also, but some schools have used their local police departments and community organizations that are off campus because, our campuses sometimes blur right into the community, residential communities and all. So some campuses might consider to use them. And again, I think the county departments to either provide services or information are really helpful. So we've used those. We've actually contacted some of the other schools, some of their police departments and all as well. So not necessarily formal members of our committee, but we certainly reached out and used their resources, definitely.
Can I ask a question?
Absolutely, yes. We have time for one more question, so you came in perfect timing, Teresa.
Okay, I was going to say, for Full College, President of Student Senate, I have, I think, more problems because the campus is closed to when it was open. So do you have any suggestions how I can implement this now?
Again, I'm sorry, I'm having a little trouble hearing. Karina, do you want to get us started on that, or can you repeat that question, Alex?
Yeah, so Teresa was saying that they're running into problems with the campus being closed and getting any movement with the campus being closed. So they were wondering if you had any recommendations of how could some of these efforts that you've put in place kind of be effective now?
Karina, you're welcome to start. Otherwise, what I would say is, I think it's really important that you have the higher levels of administration on board with this and supporting this. When you have that, then it's a lot easier than starting lower and working your way up. So have those conversations, get the data you need, go to your administration and get their support behind this. It might take a while, might not happen overnight. But without their support and commitment, You're right. It's quite a challenge.
And I was
Yeah,
gonna ask,
I echo that sentiment because we had very, very large support from the top administration. So that allowed time for people to actually attend committee meetings. They provided input and they felt responsible for helping implement this policy. So definitely top end support is very important.